Hi, I'm Sandra Lobaina, licensed midwife and board certified lactation consultant. Today, I'd like to talk about fetal positioning. One of the most important factors that can affect a labor is your baby's position. Now, while most babies settle into an ideal position for birth, sometimes they may be positioned in somewhat of a funky position, is what we like to call it, that can make labor take a lot longer, more uncomfortable, and sometimes even more challenging. Today, we're going to talk about common fetal malpresentations and what they mean, and some things that you can do during pregnancy to hopefully try to encourage the baby into a more optimal position. So, what is optimal fetal positioning? Well, the OA, occipital anterior position, is the most optimal position for birth. Baby is head down. So here we take our pelvis, and in that position, we want the baby to actually be like this, right? So typically what happens is they will kind of go in this way to fit. And this is obviously a smaller head than the pelvis, but they kind of go in like this. Then they do a little internal rotation, and then that actually helps them come through the vaginal canal like this, right? So this is the most ideal positioning for a baby to be born. Now, they're facing mom's back. The coccyx bone on the back is not being pushed because the head is coming around this way. It's the smallest diameter of the head that's entering into the pelvis, and this is why it's the most ideal. And then, when we talk about OP, if you've ever heard of that position, or sunny side up, posterior positioning, that means that the baby is in this position, sunny side up, like looking up at the mom's abdomen and the head on mom's back, right? So when this baby is going in through the pelvis, this is a bigger diameter that makes it very difficult for them to fit. Now, when they do get to this point, there's a lot of pressure on this back part. And you'll often hear that mom had back labor and it was so uncomfortable in your back. Well, it's because that head is pushing down on that spine and that coccyx bone, which is causing a lot of discomfort. It can take a lot longer for the baby to descend. It can be a much slower descend. It really can increase maternal exhaustion as well. OP babies are pretty challenging to come through that pelvic inlet. And although I've seen many OP babies born no problem, it can definitely be a complication that can lead to other issues in birth. So, one of the other positions that we talk about and kind of more common is called asyncliticism, right? So asyncliticism is kind of like when they're coming like this, but then their head is kind of tilted that way, or maybe they're tucked this way. They basically, what happens is they just kind of like turn their head a little bit that way. And so when, as the provider, we're feeling to see, okay, where are those suture lines? Like the suture lines that we look for when we're figuring out what position the baby is in is right here on the top. So the baby has 4 bones, okay? The little, opening that they have, the little soft spot. Well, that is their anterior fontanelle. Then there's the posterior fontanelle. And so those two, one is a diamond and one is a triangle. And we are going to see where that little diamond and triangle are and kind of see which way the sutures are facing to figure out where this baby's head is positioned. Now, when we do that, sometimes if we feel like we're going to feel and the head should be right there and then it's off to the side, we're like, oh, sutures are all the way on that side. Well, now your baby is considered asynclitic. And this goes even in the OP position. Sometimes they're coming in the OP position, their head is turned this way, their head is this way. So, it has a lot of variations. Instead of entering the pelvis straight, the baby tilts their head. So think of it like this. Ideally, we want them to walk through the doorway straight, and now they're walking in a little crooked and sideways. Again, this could increase the labor time. This can increase, the exhaustion as well, because it's taking a lot longer for that baby to go in through the pelvic inlet for you to start pushing. So it can slow progress significantly. Sometimes it even causes a little bit more pressure on the pelvic area where you're like, oh, I feel a lot of pressure down there. Yeah, because they're pushing more on one side and there's nerves there and ligaments that all play a role in how it's opening and allowing this baby to descend. Now, there's some other positions that are not always as common, but I have a nice little trusty chart here that I show my moms when I'm explaining it. And it is the breech position, transverse, and the occipital, well, OP position, which I just discussed. And so, the under normal conditions, the fetus adopts a typical position for birth called occipital presentation. Its head points downward into the bottom points upward, and its arm and legs are folded. However, sometimes the fetus finds itself in a different position. So breech presentation is when they're coming butt first, right? So there's different types of breech positions. There's frank breech, complete breech, there's footling breech. What that means is that instead of the head being down, their butt and feet are coming down, okay? Foot link would be that their feet are coming first, or one of the foot feet is coming first. Or complete breech or frank breech is when their legs are kind of up like this, but basically their butt is coming first, right? And there's a lot of risk with this positioning because there could be a cord prolapse. The baby could get head entrapment. So, if your baby is breech, depending on your provider, you might have a provider that cannot do a breech birth, and they would encourage certain positional changes and certain techniques to try to get the baby to flip before labor begins. There's also some breech providers that can do a vaginal breech birth. So you definitely want to talk to your provider about that. That should be one of the questions, and kind of ask them, like, what's your take on breech? Is this something that you do? Is this something that you have experience in? So the other positions that I explained first, these are positional malpresentations rather that most providers deal with, including licensed midwives if you're in an out-of-hospital setting, and including in the hospital, right? But when it comes to more complicated malpresentations, then we talk about the breech position. So yes, that's definitely something that you want to talk to the provider about. You want to make sure that it's something that they are familiar with and that they know how to deal with. The other one is transverse. Now, and going back to the breech position, there are cases where the babies just don't turn and you have a provider that cannot do a breech vaginal birth. So then sometimes breech births do end up in a C-section. But either way, this is definitely something that you want to research, you want to talk to your provider about, and you want to ensure that who you are going with is going to give you all of the options and give you all of the resources so that you could either get the baby to turn or that you can find someone that can perform this type of birth, right? Now, the other position is transverse. So this is when the baby is laying this way. This is a position where they are non-deliverable unless the baby turns during labor. But if they're in this position, the baby will not fit through the pelvis. And more than likely, a transverse position will end up in a C-section if they start labor like that. There's a lot of different factors, right? So let's say the water broke. Well, now there's not a lot of cushion or room to wiggle out of that position. Let's say they're kind of wedged, or they're a little bit bigger and now they're really wedged into the pelvis. So a transverse position is one of those positions that unfortunately it's very difficult for them to get out of. Not to say that they can't, nothing is impossible, but it is something that can be very difficult for them to move. So those are pretty much all of the positions that the baby usually gets into. There's some other very rare presentations like brow position, where they're presenting at the brow here, the eyebrows. There's also face presentation, which is a very, very rare malpresentation, but it can happen. I think I've heard of a face presentation once in my entire life, in my career. And so basically the baby is coming this way. So the head is kind of like cocked back like this, and they are coming this way. And this is also a very difficult position for vaginal birth. It can be done. And I have seen very old video on where it was done, but it was a really long, drawn out labor, and it resulted in exhaustion, and it resulted in a lot of different techniques and movements. to help encourage the baby to, come out vaginally. So, you know, I want to be very clear. There's nothing that can guarantee your baby's position. However, sometimes babies simply choose their path, and that's just their journey too. Remember that when you're going through pregnancy, labor, and birth, you have a passenger on board, and you're not always in control. Sometimes they are in control. A lot of times they're in control, honestly. So we have to understand that, the best thing you can do is be educated and informed of all of your choices and all of the resources that are available to you, so that when things don't go as planned, you're familiar with that, and maybe we can change the plan, right? However, there are some things that can encourage an optimal position. For one, stay active during your pregnancy. You want to walk. Swimming is amazing. It's weightless. It's really nice on the joints and the bones. It's low impact. Walking in general helps to create movement and create space. So as we're walking, you see how our pelvis moves, right? You see how that little wiggle, wiggle, wiggle? Now imagine if the baby is kind of like over here, and now we're walking. Well, guess what? It's going to shimmy, 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 and help baby get into a better position. So walking, squatting, well woman exercises, there is a whole program online called Spinning Babies. I love them. I think they have an amazing set of techniques and exercises that moms can do even early in the pregnancy to condition your body. So this is what I always tell my moms. So let's say tomorrow you're going to wake up and run a 5K, but you haven't been training for it for 8 months, right? All of a sudden you're going to get up and run that 5K. Before that first mile, you're going to fall flat on your face if you're not trained for it. The same thing goes for labor. Labor is work. It's hard work. You want to train for this big day. It's like a marathon. So you want to exercise, you want to walk, you want to stay active, you want to squat. For the most part, most people live a very sedentary life. They're working in offices, or they're working from home in a chair. You want to get up and you want to squat down and open that pelvis and get those bones and joints nice and limber and loose, so that when you're squatting in labor, when you're walking and trying to shimmy this baby out, you've been doing it all these months, and now your body is conditioned and ready for that big day, okay? You want to avoid slouching. Like when I slouch like this is what happens. I'm slouching, and my baby, instead of staying like this, it's like, okay, well, I'm going to lay like that too, because this is more comfortable. And guess what? That baby goes into an OP position. No, we want to have support. We want to sit forward, want to sit with our legs nice and open so our belly has a lot of room. And that way it encourages that baby to stay in that optimal occipital position. So, or anterior position, sorry. So, you want to avoid slouching, avoid reclining, have support in your back. When you're walking around and you're doing things in the house, or maybe you have a toddler, or maybe you're at work, they have belly bands. You can wrap your belly with a scarf. This is going to be so helpful to keep that weight off of your bottom extremities. It's going to help give you some support in your back too, but it's also going to encourage that the baby stay in a more optimal position once you've been doing your exercises and getting baby in the optimal position. So, using a yoga ball is another great tool. Forward leaning positions like hands and knees, when you do like the cat cow to yoga position, where you get on all fours and you're basically going like curling your back, doing some breath work, going out, in, and letting all the air out. So you're kind of like going like this, up and down. So you want to do these positions because it also helps to get baby off of your back. Or you can do it over the counter, like lean over the counter, open your legs, go side to side, really open those hips, rock, movement, upright, active. This is what we need to make sure that our baby stays in the most optimal position. Pelvic floor therapy is something that I highly recommend to all of my clients. It really can help address asymmetry. It can improve mobility. If you're one of those people that like, oops, I sneezed and oh my gosh, a little urine came out, that's not normal. Okay, just so you know, if your family or someone in your family, oh yeah, that happens to all of us, it's not normal. We need to do some pelvic floor strengthening so that our pelvic floor is ready for labor and birth, and even in the postpartum, because it not just affects your labor and birth, but it can affect you in your postpartum healing journey as well. We don't want to be in diapers for weeks after our baby is born. We may have to use some diapers in the first couple days because we have postpartum bleeding, but after that, we don't want to worry about urine leaking, and we don't want to worry about feeling like, oh my gosh, I feel like everything is just falling out. I've had moms tell me that, and that's usually because they have a weak pelvic floor. So, those are definitely something that it's some techniques that we want to look into. Daily stretching, so hip openers, deep squats, hold on to the back of a chair so you can literally just get like the back of your chair. Just go like this, hold on to it, give yourself some stability, and squat all the way down. And make sure that when you squat, you stay with your feet nice and flat, nice and shoulder width apart. Try to bring your butt all the way down. If you ever look at a toddler when they're squatting down and they're playing, that's the most effective squat that any person can do, and it comes naturally to them. So we should be doing the same thing. But because of our sedentary lives and not really being as active as our ancestors, our muscles have kind of forgotten how to do those movements. So we want to practice and get ready for it, because birth takes all of that. It takes for your body to be conditioned, to be ready, to be well nourished, and to have all those muscles nice and limber and ready for this marathon that you're about to run. So either way, that is what malpresentation is. There's a lot of like misconception, and sometimes when your provider tells you, oh, your baby has a malpresentation, or oh, your baby's asynclitic, and you're looking at them like, what does that mean? So you really want to educate yourself on what all of these things are and what to do to hopefully try to prevent it, or at least to help encourage your baby to get in the most optimal position for vaginal birth, right? So if you have any questions, please put them in the comments. Follow and subscribe. I'd love to hear from you, and we'll see you on the next one.